Future proofers, future people focused, have a great self-perception.
Professor Gordon Emmerson, thank you so much for being here today and agreeing to our interview.
It's my pleasure.
You're an honorary fellow at the Victoria University in Melbourne.
That's right.
Author of several books, and 20 years ago you've developed resource theory and resource therapy and have been working with it as well as teaching it ever since.
Well, all that is true except resource therapy has just been developed in the last few years. I was working with Ego-State Therapie before that, and my work pulled me away from some of the central themes of Ego-State, and so I developed resource therapy.
Would you like to explain what is resource therapy and how did you develop it?
Resource therapy is a parts therapy, like Ego-State. I started as an Ego-State therapist, and I found some of the central theories of Ego-State didn't fit what I was finding with clients. Ego-State has a conception that the personality splits and divides and splinters off into ego states. And there's a core personality and a few states on the side of that. And my conception of resources in resource therapy is that each one of the parts develop in childhood, and when we do something over and over and over and over again, our brain actually grows to where that activity becomes commonplace for us, and that becomes one of our resources, that becomes our resource state, and all of our states are resource states. So there is no core personality, there's just all of our states. And there are some other differences in terms of how introjects are interpreted and what to do with trauma, and they're cousins. They both come from the work of Paul Federn, but resource therapy is a little bit different than Ego-State.
You've just mentioned trauma. How would you deal with trauma or treat people who've experienced a traumatic experience in resource therapy compared to Ego-State therapy?
Ego-State therapists often will bridge to a trauma and then have the part that felt traumatized. I call that part a baited state. Mm-hmm. It's been baited, it's taken on emotion from the traumatic event. The Ego-State therapist will often have the client fight with the person that has traumatized them, and sometimes they'll have them hit pillows and things like that. And in my therapy, in resource therapy, we bridge to the trauma, but we don't have them fight. We tell the client that this isn't happening now, this is a memory fragment, and that person is not real now, so we can shrink him down to 1 inch tall. Please don't step on him, because if you step on him, you won't be able to talk to him. And so it's empowering to that state to realize that there's nothing here that's frightful. And then I encourage a more nurturing state to come in and be with that state that had been traumatized, to leave it feeling safe and secure and supported. And it's a huge difference. And I think that is quicker and easier for the client than having them to fight the provocative person, because if you fight the provocateur, that actually empowers them. That says you have to fight. There's something there that has to be fought against, while we tell the client there's nothing there. It's just a memory fragment. It's not happening now.
You've mentioned the different pathologies earlier. Would you like to explain them a little better?
Sure. My conception of the psyche is that we have lots of different states. I call them resource states because when they can come out, they can be our resources. And therefore, resource therapy. When resources aren't operating very well, some of them need therapy. A state in a normal condition is healthy. There's no pathology whatsoever. And in resource therapy, we want all of the states to become normal. Now, there are 4 states that can cause emotional concerns, and they are vaded. They're all vaded, baited with fear, baited with rejection, baited with confusion, and baited with disappointment. The behavior area is what I call retro states. The client has a behavior that they no longer like. They wish they didn't do that. And there's two retro states. Then conflicted states, if two states are both wanting out at the same time. A lot of people have a work state and a rest state. The rest state will come home and be tired and sit down to watch TV or something, and they hear this work state in their head, you lazy slob, you should be doing something. Those are the 8 pathologies. Four baited states with unwanted emotions, 2 retro states with unwanted behaviors, and conflicted states, and a dissonant state. And we have in resource therapy very distinct regimens for each one of those pathologies. After a person's state has been diagnosed into one of those pathologies, there is a set of actions, resource actions to take to help them move from that pathological state to a normal state.
With resource therapy, you diagnose just a part.
That's right.
As opposed to the whole person.
Mm-hmm.
Why is this helpful to the client?
Clients like to learn that it's not them that's a problem, it's just a part of them that's having a problem. And especially with resource therapy where they realize, yes, there's that one part over there that has this issue, that makes them feel better even before therapy proceeds. But I think there's no doubt that we have different parts. Part of me wants to do one thing, another part wants to do something else. A client will have one part that gambles and another part that hates them for gambling afterward. Like I said before, you can be sitting at home doing something when hear another part saying you should be doing something else. So clients really connect with this thing about, yes, I know I've got different parts. And so it's beneficial both for therapists and for clients, in that it makes clients feel better to know that it's just part of them, and it helps clients get what they want when they come in.
What makes resource therapy so effective?
I think it is the 2 or 3 things. One, I think it's the best therapy to be able to isolate the state that has the issue. Because by being able to diagnose the client into one of those 8 pathologies very quickly and go through the steps to make sure that the right state is out, a lot of therapies spend weeks and months and years talking to a surface state that isn't the state that has the issue. It's not the state that is highly emotional, or not the state that's actually doing the rage behavior. And to bring the state out that has the issue, that at once gives an opportunity to have real change. And then the other thing that makes resource therapy so effective is the actions have been designed to actually make that change. For example, if you just bring out a state that feels traumatized and you back out, that you're leaving that state traumatized. Some therapists a traumatized state will come out and be real emotional and maybe hyperventilate, and the therapist will say, let's just relax a little bit, let's just relax down. And what that is doing, that's bringing out another state and leaving that traumatized state there. And then talking to this more relaxed state, the traumatized state isn't being worked with directly. So with resource therapy, we want to make sure that we work with the traumatized state directly so that it gets to express, it gets to feel the support and the empowerment. And so that's very effective when you're talking directly with the state, with the issue.
How, as a therapist, how do I get bad states on my side?
See, I don't think there are bad states. But you're saying a state with bad behavior.
Yes.
Let me give you an example of, I had a job one time where when an angry parent came in, they were sent to my office. And the door would fling open. and there would be this angry parent standing there. And I would say, just a minute, before you say anything, I can see you're really upset. And I just want to say, a lot of parents never come in here at all. I don't know if they care enough about their kids to come in here. And I can see you're really upset, and that tells me you care a lot about your child, or you wouldn't be here, and you definitely wouldn't be upset. So I want to hear what's going on. Come in and tell me what's going on. That state of the parent that was so angry has been heard, been understood, has gotten appreciation for what it's doing. It just calms down immediately, and the parent is able to say what's going on. So with a retro state, you do exactly the same thing. You appreciate it, you thank it, you say, I'm glad you're there, I want you to be there, I want you to be able to continue doing your important role. Let's just find a way you can do it and be liked by the other states, because you deserve to be liked. And it's amazing how quickly that changes behavior, as long as the client wants the behavior to change. If the client doesn't want it to change, I mean, the prisons are full of people who don't want to change. And that's sad. But if they really want to get rid of a bad behavior, you can even help people with personality disorders with this method. And a lot of therapies say you can't help personality disorders. But if the person doesn't want the behavior, the state with that behavior can be changed with this method. It's the retro state negotiation.